Without further ado, I'm going to pass the mic over to Rebekka Schnitter from Health Canada. She's in the Climate Change Innovation Bureau, as I mentioned before, and she's a lead author of the equity chapter in the upcoming National Health Assessment. So I'm sure she'll tell us more about that. Rebekka is going to discuss opportunities to center health equity in climate change and health activities, such as climate change and health vulnerability assessments and other adaptation measures. So over to you, Rebekka. Thank you so much.
Thanks, Pema. Hi, everyone. It's really nice to be here today. I'd like to start by acknowledging that I'm located on the traditional and unceded territory of the Algonquin Anishinaabe Nation, home to the Algonquin, Huron Wyandot, Mohawk, Anishinaabe, and St. Lawrence Iroquoian peoples. This territory is part of the Treaty of the Crawford Purchase of 1783. So today I'm going to be talking about the linkages between climate change and health equity and provide some examples of where these two things intersect, discuss some potential ways in which we can ensure health equity is considered in climate change and health activities, such as vulnerability assessments and adaptation efforts. And then I'll end with just a brief overview of the National Climate Change and Health Assessment that's being led by Health Canada and highlight the health equity chapter and what you can expect to find in it once it's published. So I'm moving to the next slide. So I'm sure this is not news to you, but the climate is changing, and this has a number of impacts on human health, both globally and here in Canada. Direct and indirect impacts to health have already been observed and are projected to increase as the climate continues to warm. And as Pema mentioned, we know that climate change is a human rights and social justice issue, and that climate change can exacerbate, among other things, existing health inequities. So as a result, the health impacts of climate change are not experienced in the same way across Canada, and some populations and communities are disproportionately impacted and may face challenges and barriers to taking protective measures and adapting to climate change. So for example, during an extreme heat event in Montreal in 2018, studies found that social isolation and low income were risk factors in heat-related deaths, and that populations with those factors living in urban heat islands were twice as likely to die from heat-related causes compared to those living elsewhere. Next slide. So awareness and concern about climate change impacts is growing. The public health sector has recognized climate change as a significant issue, and adaptation efforts are ramping up. A number of health organizations in the country have published climate change and health reports and have made calls to action. I'm sure you'll all be familiar with youth-led activism and initiatives that also have calls for climate action. A number of municipalities have declared climate emergencies, and national surveys indicate that Canadians in general are really concerned about climate-related health risks. Next slide. And with this, there's been increasing recognition of the health equity dimensions related to climate change impacts, as well as mitigation and adaptation activities. So this is just a sample of some recent reports that contribute to our understanding of the linkages of where important points of intersection between climate change and health equity are occurring. Next slide. So climate change and health equity intersect in complex ways. Existing health inequities can influence and shape vulnerability to climate-related health risks. Climate change can further exacerbate existing health inequities. Climate change interventions and adaptation strategies can advance existing health inequities or, on the other hand, promote health equity. And mitigation and adaptation efforts from other sectors also have implications for health equity. And in the coming slides, we'll get into a few examples of these. Next slide. But first, I just want to highlight that it's really important to consider equity in climate change activities because the absence of such considerations can result in some undesirable outcomes. So for example, without health equity considerations, climate change and health activities may inadvertently exacerbate existing health inequities. We run the risk of overlooking critical vulnerabilities and needs. Adaptation measures could result in inequitable outcomes and even maladaptation. And there's also significant impacts on the health system. So you'll see the example on the slide here that there's some major economic costs associated with health disparities when they go unaddressed. So let's dig a little deeper into some of these main dimensions of health equity and climate change. So we know that all people in Canada are vulnerable to health risks related to climate change, but variations in climate change vulnerability exist. So existing health inequities can increase those health risks. For example, studies of large urban centers in Canada have found that indicators of material and social deprivation have been associated with increased exposure to air pollution and increased incidence of negative health outcomes, including cardiovascular, respiratory, and cancer mortality. Climate change is expected to exacerbate the health risks associated with air pollution. So particular populations and neighborhoods across Canada may experience increased vulnerability to air pollution health effects related to climate change as a result of those existing health inequities. So they're already disproportionately exposed to air pollution. Next slide. So as I mentioned before, when it comes to climate change adaptation measures, the results or outcomes of the measures could have unintended consequences on certain population groups. So for example, common adaptation measures to address extreme heat are to use air conditioning and to increase green spaces to reduce urban heat islands. So there can be unintended consequences of these activities. For example, some studies indicate that increasing green spaces can perpetuate gentrification and increase property values, which may lead to the displacement of low-income residents and small local businesses. Air conditioning units can also generate a lot of waste energy, which can increase temperatures and further impact those that don't have access to air conditioning. And so this isn't to say that we shouldn't be using these adaptation measures, but we need to carefully analyze and consider how everyone will be impacted and identify potential negative consequences before implementation. Then simultaneously implement policies or measures that will mitigate those negative impacts and maximize the benefits. So for example, rent control policies and other strategies to maintain housing affordability might be implemented with green spaces, and cooling centers may be opened in neighborhoods where there's a lack of access to air conditioning. Next slide. So adaptation and mitigation measures, when planned with care, can promote health equity and or strengthen determinants of good health and increase resilience of climate change. So there's two examples on the slide. The first is an electric car share program that helps reduce greenhouse gas emissions and reduce air pollution in the city, which is a major health threat. And the program prioritized service in disadvantaged communities that have highest exposure to air pollution. They also provided reduced membership fees to low-income residents. So they're really targeting communities and neighborhoods that are disproportionately impacted by local air pollution and the health risks associated with that, while at the same time reducing traffic-related greenhouse gas emissions. And then the other example, a Canadian example, is the Healthy Homes Project. So this is really a collaborative project that aims to develop climate-resilient housing in order to adapt to the changing conditions in Nunavut. But the project also, among other things, reduced the health impacts from overcrowded dwellings and mold. So this is a really good example of adaptation actions that simultaneously strengthen determinants of health, which can decrease vulnerability to climate change-related health risks. Next slide. Okay, so I'm going to transition now to talking a little more about some tools and resources that are helpful for centering health equity in our climate change and health activities. Some of you might be familiar with climate change and health vulnerability and adaptation assessments, often called VNAs. These are a common tool used to understand climate change vulnerability and adaptive capacity of individuals, communities, and health systems. And there's a number of steps to an assessment, but basically they include collecting baseline data and information, understanding key health risks, and accounting for populations that experience disproportionate impacts or increased risk, understanding future risks as well, and then designing and implementing adaptation strategies to protect health. So right now, about 35% of Canadian health authorities have already or are currently conducting these assessments at the local and regional level. And when a health equity lens is applied to VNAs, they can help us understand the conditions that contribute to the climate change vulnerability of that geographic region that's being assessed and determine how existing health inequities may be exacerbated with climate change. And so information on how select groups and populations experience increased vulnerability to climate change health impacts due to these existing health inequities can really guide adaptation actions that are equitable and address the needs of everyone. Next slide. So guidance on how to conduct a VNA does exist. The WHO provides guidance, as well as the Ontario Ministry of Health. They have a workbook that our office supported the development of that provides templates and really breaks down the steps of a VNA. Unfortunately, not a lot of this current guidance explicitly integrates health equity. So this slide provides some resources and tools that can complement the VNA process and support integration of health equity considerations. Given the time limit today, I won't go into too much detail here. I have provided examples of guidance and resources for each of these categories that will hopefully be helpful for you. So starting with health equity impact assessments and SGBA frameworks, this is likely not new to you. They are typically analytical tools that you can apply to research projects, policies, and programs and allow you to assess how the project will impact health equity. The examples provided on the slide here, they haven't been designed specifically for climate change and health activities, but the guiding questions and the assessment practice can really complement the VNA process. Resiliency and asset mapping are community-based exercises and tools that can identify people, organizations, spaces, and other intangible factors that contribute to community resilience. And we know that communities have many existing resources that play an important role in building climate resilience, but these assets and resources can be difficult to identify in common sources of data. So conducting community surveys or community-based workshops and engagement activities can provide this information, which is really valuable for informing VNAs and developing adaptation responses. Vulnerability mapping provides information on patterns of social conditions and climate change vulnerability of a particular region. And this is usually accomplished by, for example, developing a social vulnerability index, which uses social vulnerability indicators. So things like socioeconomic status, housing tenure, education, age, race, access to medical services. And this is often overlaid on a map with biophysical impacts or risks of climate change. So a really great example, Vancouver Coastal Health, in collaboration with UBC and Fraser Health, they recently developed a climate vulnerability index and mapping project, which measures how susceptible communities in the VCH and Fraser Health region are to health effects of extreme heat, wildfire smoke, flooding, and air pollution. And so they have an interactive website that really highlights how these climate hazards affect everyone, but disproportionately impact those affected by factors like low income and racism. And then finally, climate change projections are really helpful for understanding the mortality, morbidity, or other health outcomes related to climate warming that may change in the future. So it's important that these projections incorporate factors that can influence vulnerability to future health impacts of climate change. For example, things like changes in demographic and socioeconomic conditions, urbanization, land use, as well as the extent that equity issues are addressed. Next slide. So of course, community engagement and including diverse voices is also very important. Residents and community-based organizations can provide valuable information, including the history and social context of a neighborhood, past experiences of climate events, as I mentioned before, assets and resources, and the success and challenges of previous public health interventions, which all offer a lot of valuable information for VNAs. And studies and promising practices indicate that the equitable inclusion of diverse voices needs to occur at every stage of the VNA process. Next slide. So typically your VNA ends with designing and implementing adaptation actions, and evaluating adaptation measures for impacts on health equity can also be useful. And this ensures that actions do not inadvertently exacerbate inequities or negatively impact parts of the population. Unfortunately, we don't yet have a lot of knowledge in terms of effectiveness of adaptation measures and the impact that they have on health equity, but there's some tools and frameworks that are emerging that will be able to help with this. So I've already mentioned the Health Equity Impact Assessment tool. And the other framework on the slide here is a theoretical evaluation framework specifically for climate change adaptation measures. And this specific framework provides guiding questions that allow you to analyze how different groups are impacted by the action by looking at the implications on specific determinants of health. And this is used as a measure of effectiveness. So assessing adaptation measures prior to implementation is important, but then continued monitoring and evaluation can help provide information on how effective that measure is, as well as help understand if the outcomes are equitable and what impacts there are on health equity. That ongoing evaluation will alert you if there's areas that may need to be tweaked or reworked to make sure that we're really maximizing the benefits and minimizing any negative impacts. Next slide. Okay, so finally, as I mentioned, Health Canada is leading the National Climate Change and Health Assessment, and this report will provide an assessment of the risks of climate change to the health of Canadians and the healthcare system, and will also support actions by health decision makers at all levels of government, as well as those in the public health and healthcare sector. So you'll see on the slide that the report includes chapters on a number of health risks, and each chapter also includes a discussion on adaptation measures as well. So we anticipate the release of this report late this summer, so summer 2021. Next slide. So I'm the lead author for the Health Equity chapter, and this is a new chapter for our office this year. Our past assessment reports haven't included a chapter dedicated to health equity, so it's been really exciting working with my colleagues on the development of this. The Health Equity chapter really builds on everything that was presented here today. So it establishes the linkages between climate change and health equity, specifically highlighting the relationship between equity and climate change vulnerability, and it explores the role of adaptation in advancing health equity. We also have a discussion on knowledge gaps and future research needs. And my final slide is just all of the references and guidance materials and resources that were noted in my previous slides. Thank you.
Thank you very much, Rebekka. Excellent presentation, and there's been some good questions and notes in the chat box that have been shared. I think there's a few people on the line who are grappling with some of those issues related to integrating equity into assessments of different kinds, and a few folks who are actually engaged in vulnerability and adaptation assessments within their own organization. So thank you for your presentation so much. We're going to hold questions until the very end, and I encourage people to post their questions in the chat box in the meantime.